Have you ever wondered what happens behind the scenes with organ transplants? Well, let me tell you a story that's as jaw-dropping as it is important. Recently, two men in the Northeast received kidneys from the same deceased donor. That sounds like a life-saving miracle, right? But weeks later, both of these men got sick. Really sick. And the twist? It wasn't your typical post-surgery complication. The first man, a 61-year-old from Boston, started having all these weird symptoms about 10 weeks after his transplant. We're talking vomiting, intense thirst, nausea, abdominal and back pain, and a fever. None of the usual treatments worked, and soon things spiraled. He went into respiratory failure and shock, ICU-level stuff. But here's where it gets wild. Doctors noticed a purple rash on his stomach. When they did a biopsy, they found roundworm larvae, yes, actual parasitic worms, in his lungs and skin. His blood work was off the charts with a certain type of white blood cell that usually fights parasites. Turns out both he and another man, a 66-year-old from Albany who got the donor's other kidney, had been infected with a parasite called strongyloids. This is a type of roundworm you usually find in tropical areas. Not exactly something you expect after a big surgery in the Northeast, right? The craziest part is how it happened. The original organ donor had the parasite in their system, but no one knew. After the first patient's medical team figured it out, they were able to alert the second man's doctors. So the second guy got diagnosed and treated almost immediately, and he's doing great now. Both men were put on anti-parasitic meds, including ivermectin and albendazole. The first patient had a rough ride, but his kidney is stable now. The second recipient, who got quicker treatment, is thriving. So what does this mean for you or anyone waiting for a transplant? First, don't panic. This story is super rare. Organ transplants save thousands of lives every year. But it does highlight why doctors watch for every possible risk, and why it's important to communicate any unusual symptoms after a major surgery. You never know what twist might pop up in real-life medicine. Sometimes truth really is stranger than fiction. If you found this story as wild as I did, hit like, subscribe, and let me know in the comments your thoughts on medical mysteries.